So my name is Verna Varelli Claypool, and I'm an associate professor in the College of Medicine here at the Health Science Center. And my responsibility is in the physician associate program. So I know there are a lot of my physician associate students out there. So welcome to you guys. And this afternoon we are starting one of our last sections of clinical medicine, and this is emergency medicine. So this afternoon, we're going to do an introduction to emergency medicine. So even before I came to campus as a full-time faculty member, I would do this particular event. And what this particular event is to talk to you guys about things that you're going to see in the emergency department. Things that paramedics or basic EMTs might bring to you in the emergency department. A lot of you on rotations will go out into rural Oklahoma. So when you get your patient is not going to have all the IVs started and the medication given and all of those kind of things, because you just have a basic ambulance service. So I'm going to just start with a few questions. So I'm going to hold this up. Does anyone know what EMS stands for? Emergency medical services. Okay, so when you guys say ambulance, this is really what you're talking about. You're talking about an emergency medical service. One thing I always tell you, actually usually our EMSA medics tell you, but I will tell you this time, is that not all ambulances are EMSA. So a lot of people, because you live in the metropolitan area, either Oklahoma City or Tulsa, EMSA, the Emergency Medical Services Authority, is the name of the ambulance service here. But if you live in Altus, for instance, you're going to have the county ambulance service there. So it's not going to be EMSA. So you would be correct to say that's an ambulance, but not all ambulances are EMSA. So I want to talk a little bit about the 3 levels of emergency medical technicians. So these are the people that assist you on the ambulance. We're not all ambulance drivers, although yes, part of our responsibility is to drive the ambulance. EMTB stands for EMT Basic, Emergency Medical Technician Basic. And there's a curriculum for that. The next level is EMTI or EMT Intermediate. And in the state of Oklahoma, the intermediate EMT can do things like intubation. Professor Elder is going to show you what an endotracheal tube looks like. They can start IVs. Again, Professor Elder in his station will show you what those IV catheters look like. And they can also assist with certain medications. Then the highest of the level of emergency medical technicians is the EMTP, or the EMT paramedic. So this is where you have the provider who can not only start your IV, but give medications, can do cardiac monitoring, can defibrillate, a lot of different things. So this is the highest level of EMT, is the emergency medical technician paramedic. So one thing I do always mention when I talk to you guys is something called individual protocols. So in Oklahoma, you may be working in rural Oklahoma, and I reference that a lot because a lot of you guys will rotate, do a clinical rotation in an emergency department in rural Oklahoma. Well, not all of those ambulance services have a paramedic on them, but the state of Oklahoma has said if there is a paramedic on that ambulance, that paramedic can do paramedic procedures. So I'm an old paramedic, so if I was working with a basic EMT, I could do paramedic things based on something called individual protocols, in which myself and my medical director had said, okay, so if Bruna's working this day, or any other paramedic, and paramedic advanced life support procedures needed to be performed, they could do that. If I'm not working that day and the ambulance service is staffed by 2 EMT basics, your patient is not going to come to you with all of these things already accomplished. So I always mention individual protocols, because even though you may have a basic life support ambulance service in rural Oklahoma, if there is a paramedic working at a certain time, your patient is going to have a lot of that stuff already performed before you get to them, before they get to you in the emergency department. And that's something called individual protocols. The state of Oklahoma has that. A lot of other states have it as well. Want to talk a little bit about how 911 operates. Again, different depending on where you are, right? You call 911 in the Oklahoma City metropolitan area, your phone call gets answered by a 911 operator who asks if you need police, fire, or EMS. And depending on what you need, if you need an ambulance service, that call gets transferred to an emergency medicine dispatcher in a different location. Same thing with fire. If you call 911 in rural Oklahoma, it's probably going to be answered by a local small municipal service, or it's going to be answered by the county sheriff's department. They're probably not going to ask you, what do you need? But they'll probably ask you what your emergency is. So again, a lot of how 911 operates is dependent on your geographic location. Okay, what I want to go over now is just some things that I have in my go bag. So I've worked emergency medicine for a whole lot of years. As a lot of you know, I'm an old medic, ran my first ambulance call when I was 17 years old. I'm much older than that now. After I went to PA school, I then worked emergency medicine as a PA. So I worked at several different emergency departments. So I put together a little bag that was helpful for me no matter where I went. I'm going to start with this book here. So you guys are going to go get ready to go out on rotations, and you're going to say, I want this, I want that, I want this app, I want this book, all of these things. This is the only book that I purchased after going on a rotation. And I graduated from PA school in 1999. So that's how old this book is. I recommend that every one of the PA students out there have this book. Now, your edition, of course, is not going to be the second edition like I have. Yours is going to be updated. But I still use this to this day. And where I use this is something in here. So if I am repairing a laceration on the face, I don't remember which nerve goes where and how a certain location is innervated. But this book is very helpful to me, because if I want to repair something around the lip, I don't necessarily have to put my numbing medicine right in the lip. I can put it in this second mandibular bicuspid, shows me where it is, gets me the lower lip, shows me where I can get the upper lip or the eyebrow. So this is a nerve block, right? It's going to numb that whole area, and it's going to be very helpful for me when I'm going to suture that laceration. I don't have to put a whole lot of medicine directly into my wound. So I use this, again, to this day, all the time, because I don't remember which nerve is where and how I can numb it up. So go to the book, have a look at it, very, very helpful. This also talks about other types of lacerations. It also teaches you how to do for instance, a nerve block on a digit, so on a finger. So if I have a dislocated finger, I'm going to numb that finger up, and then I'm literally going to pull on it and pop it back in place. Okay. So this is really, really worth it. Again, I always say I have no financial interest in this textbook, but I think you'll find it really, really helpful for you. I don't know, Professor Elder, do you know if this comes in a pocket guide or anything?
No pocket guide. It still has the same shape thickness, and it looks exactly like that. If I'd have thought I'd have brought mine, but it's,
So,
I think it's 5th edition.
No Pocket Guide, and Professor Elder has the 5th edition. Okay, thank you for making me feel so old. All right. So a few other things I have, just a pair of Professor Gadget goggles if you want them. You will end up doing a lot of fine work, whether it's removing a foreign body or a tick from a little boy's external genitalia, and these come in very handy even with your young eyes. This also can come with a little battery adapter with a light on it that you can order separately. So these are called jeweler's loops. So people who repair jewelry wear these. You'll also see surgeons who do fine vascular work and plastics work in the OR also wear these. Comes with a little light, some batteries that you can put a directional light on. So everything's up here, and then you still have your hands to be able to work. Just get a cheap pair of cheaters, magnifying glasses. These are +3s. Not that I wear those all the time, but kind of in between this and this. You know, if I don't need something quite so strong, but I need a little more magnification, I may use these. Pair of trauma shears. Always, always, always hang on to yours. It's kind of like your stethoscope, right? You don't ever really want to say, oh, here, yeah, you can borrow my trauma shears, because you know what? You're not getting them back, okay? Even though it's got my name on it, I'm probably going to find them, if at all, weeks and months later laying somewhere else. I also have just a flexible tape measure. So this comes in very handy if I'm going to splint an extremity. So I go over to the patient and I kind of measure. I usually measure the unaffected limb. So if you broke your right arm, I'm going to go to your left arm and measure it and see how much of that padding and that splinting material I need. I'm going to say, okay, so I need 24 inches. I'm going to go over to where all of my splinting and casting material is. I may already have a prepackaged one that's 24 inches in length, and I'll say, oh, well, I'll use that one. Or I cut it off of a great big roll. And for those PA students, we'll be splinting and casting at a later date. I also have a little pregnancy wheel, and this is very helpful when female patients come in and you are assessing their pregnancy status. They are pregnant. You go to the day of their last period on the wheel, and you can see when their estimated date of delivery is. A couple other things I have, and again, I have no financial interest, but I always have students say, where did you buy all that stuff? Well, in Oklahoma City, there's a couple Steve's Wholesale Tools. There's one in Tulsa. Harbor Freight carries these things. And so I have purchased my trauma shears there, my alligator clamp, which is used for foreign bodies. So the way this works is a little different, right? I keep it closed until I get to where I'm going to get my foreign body, and then I open up, and when I close, then I've got my foreign body. So this is called an alligator clamp, or actually an alligator forceps. And it's bent like this so I can go in an ear, I can go up a nose, I can go in any other orifice that I need to. Something that a lot of you may say, well, that's kind of crazy. Why does she have a big old magnet? Well, my story for this is many years ago when I was a student, I was rotating in Atoka, and one of the patients that I had was from one of the local penitentiaries, and he was stabbed in the neck. Well, the tip of the blade stayed in his neck and could not get it out. So they brought him to the emergency room. Every time I went in there with forceps or a hemostat and tried to grab it, this thing would go away. I'd never see it. So one of the nurses went down to the floor and got the magnet that they use to check people's pacemakers. And she held it right here by the neck. That metal popped right out and I was able to grab it. So I went and got a little kind of cheap magnet, and I have used this many times. This is a forceps. So you guys are in medicine now, right? Not a tweezers anymore. But this is a splinter forceps. So really, really pointy on the ends. So I could get in something and literally, think about it. If you have a wood splinter or something and you're trying to grab it, if you have a really sharp point on the end of it, you're much more likely to pull that out. And then I always have a pair of needle nose pliers and wire cutter. I use these a whole lot with fish hooks. I've used them, these are my needle nose pliers to get any kind of projectile, sometimes out of a forehead, out of some other location. So all of these things, not really expensive, but very, very helpful tools. And I'll tell you, I can't tell you how many of my emergency medicine colleagues have given me a bunch of crap about having a needle nose pliers and a wire cutter. And then again, how many times did they come and say, hey, can I borrow your pliers and your wire cutter, right? So even though a lot of ERs and a lot of urgent care stock these things in with their medications, it's always gone. So I just went ahead and bought my own. They're, again, not very expensive. So that's what I have in my go bag. When you guys get out there and you maybe get to a location where you need something else, then, you know, maybe you'll say, hey, I'm going to add this to my go bag.